These are the shade guides that we use in practice. We have 3 different shade guides. We have a classic Vita shade guide, we have a bleach shade guide, and we have a base shade or stump shade guide. With the Vita Classic guide, it runs from A1 to D4, but there's a particular order that they should be set out in, and we'll outline that for you below, so you've got a PDF that you can copy and make sure that they're in the correct order. With the bleach shade guide, this one's made by Ivoclar, this is made by Vita, and this is the one that we use. There's lots of different brands of bleach shade guides out there, so it's really important when you're communicating with your lab that you're clear about what the brand is of guide that you're using and that you're both using the same shade guide. Same thing for the base shade guide. We've got an Ivoclar guide. It goes up in order from ND1 to ND9, and so again, really important to communicate with your lab which brand you're using so you're both on the same page, because otherwise you'll end up with discrepancies and you won't know why. For shade taking for a patient, obviously if the tooth is unprepped, you're going to use the regular either Vita or bleach shade guides, and you've got the base shade guide for when you're dealing with prepped teeth. So right now we're going to look at a lovely model with our unprepped teeth, and we're going to take some shades. So if we grab our shade guide, and if you could just smile for us, and have a look along the shade at which one's probably the best match. So we're looking at around a B1 here. So if we take out our B1 tab and pop it edge to edge on her pretty teeth, and we can see a good similarity. The canines are a little bit darker, as would be expected. So we can have a look, and we can also give her a shade match for that canine there. And again, just taking that edge to edge to make sure that that's a good match. To record this, and so that we can share with the lab, I'm going to ask my assistant to grab these shade tabs and hold them on the incisal edge of the teeth while I grab my camera to take a photo. Bigger smile for me. And just flatten the shade tab towards me, Hermione, so that it's really clear on the camera. That's it. Perfect. Thank you. So edge to edge incisal, flatten towards me. Bigger smile for me, please. Now, when you take the image, and we'll pop the image in here, you'll see sometimes the light will reflect, so you can't clearly see the shade number. So just do that again and make sure the lab's going to be able to see which tab it is that you're using to make sure there's no complications later. Just covering the B2 slightly. And just make sure they're both facing me, then the light won't reflect. That's it. And that's much clearer, as you can see in the image that we've popped in there for you. Sometimes when it comes to choosing shade, particularly if you're choosing shades for ceramics, so maybe for a single incisor, which is typically one of the hardest things that we do as cosmetic dentists, or even for a smile makeover where a patient may be choosing between a BL3 or BL4 and not really sure what the right shade is for them, then we definitely want to show them in the chair the different shades that they've got. So we grab our mirror and give our recommendation and hand the patient the different shade tabs so they can have a look in their mouth which shade they think they might prefer. And then we also encourage the patient to look in natural light. So if you come with me and come over to the window, here's a mirror for you, and you could have a look at a couple of different shades. If I give you a comparison here for BL3. So the patient can be sure in their decision in different lights. Sometimes we'll even remove the surgery light, so they've got another light source to look at. Perfect. So when you have several shades in your preps, then you may want to annotate the picture so it's really clear to the lab what they're dealing with and what they may need to mask. So I've got an example here of some preps that I've done for a patient. And then if you tap on the image and hit this edit button, we'll make sure we've got a black pen selected for good thickness. Then we can quite easily annotate the image to show that the body here is an D2. But there are certain areas which they may want to look at masking out that are a bit deeper or darker at an ND3. So feel free to very quickly and easily annotate the image and save it for the lab. It's disappeared. There you go. So that you can send it to them and they can see exactly what they're dealing with so you get a better result.